As you probably have heard, deep brain stimulation is a relatively new treatment used in Parkinson's disease. It's been in widespread use for at least the last 10 years. It's not experimental. It's paid for by all insurance companies and is used in two primary situations in Parkinson's disease. One, which is quite uncommon, is for people who have what we call refractory tremor. That is, a tremor that doesn't respond to any of the medications that we have for Parkinson's disease. There are occasional patients who may have severe tremor that doesn't respond to medicine, and those patients do extremely well with deep brain stimulation. The tremor virtually goes away when the stimulator is properly inserted and turned on. The more common scenario for using deep brain stimulation, however, is in the patient who has uncontrolled fluctuations.
I've been evaluated by two separate neurologists and two separate neurosurgeons, and they both agree that it's appropriate for me to have the DBS at this time. And the way we do it in Rhode Island, it's a three-part surgery. The first part is to put fiducials or little screws right in the skull in four places, and I've had that done. They've been placed in the skull. The next surgery is coming up in about 3 weeks, and the doctor will put a platform on my head to secure the platform, and that's why the screws are there. He secures it to the screws, and then he will operate through the device and put the electrodes about 4 inches into the brain. And then the following week I have the third surgery, in which he snakes the wires down to my chest and connects it to a battery pack that is placed under the skin in the chest. And then there's a series of adjustments that lasts about 6 weeks. You go to the doctor once a week for about 6 weeks, and they adjust it and finally get it to the right place, and will either drastically reduce the meds or hopefully have me completely off the meds.
People who've been taking L-DOPA for a few years frequently run into problems where the medicine doesn't provide a stable response. When they take their medicine, at times they will have excess movements, which we call dyskinesias. Michael J. Fox, you may have seen on television, often has these. Those are medication side effects. But when we cut down on the medicine to try to reduce those side effects, then the patient often pays a price in terms of increasing slowness, stiffness, and worsened walking.
But as far as the operation goes, it helps in the hand and so forth, so it's a big thing. It's the right hand, but the DBS is done on the left side because it's reversed. Anything that's done on the left side, it's going to show up on the right side, and vice versa. I have the implant in there, which you have no problems. You don't feel anything or anything like that. So
it's important to keep in mind with deep brain stimulation, however, that the stimulation does not make a patient any better than they are at their best on medication. Many patients think that they shouldn't have DBS until their Parkinson's is very severe. Unfortunately, by the time they reach this point, the deep brain stimulation actually doesn't work very well at all and will rarely be used. So when a patient has a good response to their Parkinson medicines, typically to L-DOPA, the deep brain stimulation will get them that good, but no better, and usually will keep them at about that level of function throughout most of the day. When patients do not respond to L-DOPA, they have some Parkinson-like syndrome, it's been experienced that those patients do not improve with deep brain stimulation. It's also very important to understand that deep brain stimulation does not slow down disease progression. This is not a cure for the disease. You won't get better than you are at your best on medication, but with a good response, you will get to be at your best, and you'll get to be at that level throughout the day without fluctuations. The illness, unfortunately, will continue to progress. And although you can have changes made in your stimulator settings, they're not going to offset the progression of your symptoms.